name's Eric Gray, and this is the first part in a series of STEM interviews with STEM scientists around the country. And I'm here with Carol O'Brien, a microbiologist at Sacred Heart Hospital in Spokane, Washington. And Carol's here to share a little bit about her career and some of the education she took leading up to her career. What college did you graduate and with what degree?
I graduated from Washington State University with a degree in bacteriology and public health.
And how many years did it take for you to obtain that degree?
It's 4 years.
4 years.
Mm-hmm.
And is it still possible? Most students are facing the prospects of 5, maybe 6 years of school. Is it still realistic to obtain this degree with 4 years?
Mm-hmm.
Yeah.
Yeah.
And would you say this program is offered around the country?
Well,
at various
even
universities?
just in our region, Eastern Washington University has a good feed into our program at Providence Sacred Heart.
Mm-hmm.
WSU is a good. We always get students from there. Montana State University, we get students from there. But it can be anywhere in the United States.
Right.
And there are some 3+1 programs. I think University of Washington, if you can graduate in medical technology and get it in 4 years instead of the 5th year.
Wow.
There's options around the country that do a 3+1.
Right.
And then that internship is included in the 4 years.
So, does your line of work as a microbiologist, do they require that you have an advanced degree, a master's or a PhD?
No, I don't have a master's degree. I'm just short of that. We don't have to do a thesis. So that's what keeps us from having the actual master's degree.
So you have the classes and
We have the 5th year.
the 5th year,
Uh-huh.
but just lacking the
Just
thesis.
lacking the thesis,
Okay.
so we don't have the master's
And
degree.
there's no pressure or
No, it's not
requirement to go
required.
and finish that
No,
degree?
the main requirement is to take the medical technology program and to pass the certification exams.
Now, is that a national certification exam?
Yes.
And does that allow you to work anywhere in the
Yeah.
country?
Except California has its own registration exam.
Of course.
And in Florida, I think Florida has
Yeah.
their own. So you have to take their state one too.
Okay.
But our state in Washington and the Northwest, we don't have to have the special state
Right.
one.
Okay.
So
I would imagine technology intersects your career all the time. Can you think of 2 or 3 of the most common tools you use throughout your day?
sure. Just something simple like a microscope
Uh-huh.
is used all the time during the day. Staining procedures. We're not as automated as a chemistry department would be or a hematology department in the laboratory. We're less automated. We are more hands-on. We actually use culture plates to look for the bacteria that, once the specimens come in and we've processed them under the hood, that includes setting them up on culture plates, which it gets really technical. They're just little Petri agar dishes. And we take the sputum and we stick a swab in there that's sterile and we inoculate the plates. And there's 3 different plates that will culture for staph and strep, or they'll culture for a pseudomonas, and we know which ones grow on what ones.
Right.
So then they get incubated in the incubator for 24 hours. The next morning we pull the plates out and we see if the bacteria have grown on there. And we report out which bacteria are growing.
I think what most people maybe don't realize is it's a very dynamic process at the hospital now where the doctor's ordering tests and you guys are working in the lab getting those real-time results for the patients, right?
Yeah. Yeah, unlike on TV, the doctors don't do their own lab tests.
No.
We are the people that do the laboratory work. And the doctors can't make their diagnosis without x-ray and lab. We're the 2 most important parts of their diagnosis. They wouldn't be able to know all what they know without us. So,
That's a good point.
yeah.
A young person deciding to get into this career, could you talk about what they could expect to make, what kind of benefits there are?
Starting medical technologists would start at $50,000 a year, and work up from there. And they get, medical and dental and retirement benefits and that sort of thing, vacations.
Yeah. Are there yearly reviews?
Yes.
For promotions or raises?
Yeah, we get a yearly review.
Okay.
And we get cost of living increases usually. If you're overtime, you get paid every penny of overtime. We do have to work holidays. We share, at our place, we share one of the 3 big holidays every year. We have to work Christmas, Thanksgiving, or New Year's, one of those 3. And then we do have to compete for vacations. July is probably the most popular time, and they kind of do it by seniority, so if you've been there longer, you have a better chance of getting your vacation. If you're new, you might not get it.
Right. Do you feel that this career would afford most people the opportunity to have a family and enjoy some of the outside hobbies that they might be interested in?
Absolutely, yeah. Oh, sure.
Okay.
You don't have to take any work home with you.
That's a plus.
Once you're done with work, you don't bring any homework home to correct papers or anything like that. Like that teachers do.
Okay.
Since I'm married to a teacher, I know what that's like.
We talk a lot about in the classroom antibiotic resistance. Can you talk about how that comes up in your daily work?
That is quite a topic, yes. We have a lot of MRSAs, methicillin-resistant Staph aureus. The buzzword for that is MRSA. I would say that our outpatient cultures are about 35% MRSA. So it's quite a big number.
Can you tell the students what some of the strangest bugs you've encountered are in your work?
We've had some very strange and very unusual ones. We just had a recent, we helped diagnose this. It was an outbreak in our state. I won't go into where, but several patients came down with something called rat bite fever, and they were very, very ill. They had gone to the hospital in this town, and they were septic, which means their bloodstream had organism growing in it, and we had a cluster of these patients all coming in, and we were the ones that got to work on the organism at our hospital here, and it turned out to be an organism called Streptobacillus moniliformis, and it is carried in rats, and it can cause infection in humans. You don't necessarily have to have a rat bite, but the rats could be exposed to dogs, and the dogs could kind of help carry that virus and get exposed to people. Act as a vector, yes.
Okay.
And the food could be one of the vectors. So that was interesting. Those specimens were sent off to the CDC.
Wow.
Yeah. When we get something really unusual, we've sent off to the CDC.
Off to Atlanta.
Atlanta.
Okay. What is the worst part of your job?
I think trying to compete for vacations and not always getting the time off that you want. We have to work short a lot. We're really quite short-handed. My field we have a lot of people my age, which I'm in my 50s, and in about 5 or 10 years we're going to have a ton of people retiring. We're short. We don't have enough people in my department to cover all the shifts, and
so a bad thing for you,
people.
But a good thing for people coming into the workforce.
Yes, yeah. There's going to be a national, we already are experiencing a national shortage of clinical medical laboratory technologists.
Wow. Okay. If you had one piece of advice for a prospective or a student who's interested in a STEM career, what would that be?
Maybe visit some places that utilize that in your community. Just see if you can job shadow, just to find out. Go on a tour.
Yeah.
Take, how you take some of the kids, your AP Bio, down to Sacred Heart and go through the whole lab. Well, that will really, a person would really feel whether they would like that or not.
Sure.
Looking at the environment and having a tour.
So it's important to get a first-hand experience of what that profession offers.
Yeah.
Okay.
If you, talk to your mom and dad and see what their friends, where do they work? Could you maybe job shadow at one of their places of work, or just get out there and see what's in the real world.
Okay. Thank you for your time tonight, Carol. It's been very informative, and I know the students around the United States will really appreciate the information you've provided them.